Me and my husband, actually, we were married in the summer of 2008, and prior to us being married is the first time I actually found my lump. I found it probably about 2 months before we were married, and a month after our wedding we found out we were pregnant. So we were super excited, and we weren't expecting to get pregnant that quickly and everything, so we were really just looking forward to that. By the time we got into the doctor, I was about 2 months along, and she said, "Nicole, this is really serious. We need to get you into a specialist to have this, biopsy to make sure that it's not breast cancer, because you have all these symptoms of breast cancer." We were, terrified. It was horrible, awful news. And so we went and we saw this breast cancer specialist. He was a surgeon. He's like, "I'm really not worried about this. I deal with breast cancer every day, and this does not feel like breast cancer to me."
I was diagnosed in April of 2006, and I had been very good about getting my mammograms every year. I would do my monthly self-breast exams and went in for my regular appointments every year, just like clockwork.
I was training for level 100 mountain bike race as my first time. So I was training really hard. I feel like I'm fit and just good to go. And a few weeks before the race, and I felt like a little knot there on my side of my breast. And, I talked to my friend and let's go check it out and see, if there's nothing, you feel good. So I did, and then they told me it's something in there, unusual, and abnormal cell is there. So that's how I started out. I was really shocked. Why me? I'm healthy, I have no pain, no family history, I exercise, I eat well.
Right around Christmas time, I went back in because it had tripled in size. It took over half of my breast. Half of my breast was completely hard, and I was getting really sharp pains. And so I went back into my doctor and I said, "There is something wrong. This is not normal." He called me at work and he said, "Hi, Nicole, I'm sorry to have to tell you this, but you have breast cancer." The initial thought that was going through my mind was my baby, because by this time I was about 6 months pregnant, and I don't think it really clicked in my mind that he had just told me that I had breast cancer. I was terrified that I was going to lose my child. I was beyond terrified.
You know how men are. It took my wife a few weeks to get me to go to the doctor to even find out that I had a lump and see what it was. All I knew about breast cancer then, which was back in 1976, was what I had heard about women getting breast cancer.
For a long time, I couldn't even talk about it without, getting all emotional, because I remember those emotions we had that day, and it was something I would never wish on anyone. It was horrible. It was absolutely horrible. We decided on the lumpectomy with radiation, and I went in a week after my initial diagnosis. I went in a week later and had the lumpectomy while I was still pregnant, obviously. So not only did I have it young, and while I was pregnant, I had one of the nastiest kinds that you could get, unfortunately.
The phone rang, and my husband answered the phone, and he looked at me and he said, "It's your doctor." And she said, "This is Dr. So-and-so, and as I suspected, it is breast cancer."
It started with my maternal aunt, and then my mother, and then myself, and then my stepmother, then my daughter, and then my brother. So we've had many, many family members deal with breast cancer, and we've all dealt with it in different ways.
When I was diagnosed with breast cancer, I just turned 31 years old. Due to the fact that my maternal grandmother had breast cancer, and my aunt and my mother, I was kind of not expecting not to get it. So when I found out that I had it, I was shocked, but at the same token, I kind of wasn't. I was like, oh my gosh, here it is, and I'm gonna have to deal with it.
Many people think of Susan G. Komen for the Cure as the race for the cure, but we are much more than that. We are in the community year-round, providing life-saving services to individuals who otherwise would not have access to care. The mission of Susan G. Komen for the Cure is to save lives and end breast cancer forever. And we do that by empowering women to take charge of their breast health, by ensuring quality care for all individuals, and energizing science to find the cures.
I had hair down to my waist, and I'm 6 months pregnant, and I'm 25, and I'm just, it should be the happiest time of my life. The thing that I remember most about that day is as soon as they started my infusion, I've always been very sensitive to the feeling and the taste and stuff. and I could feel it going in right away. And it's very cold, and you get like a taste of kind of like metal in your mouth. And no more than 30 seconds after they started my infusion, Abby just started. My belly was doing this. She started kicking, and I was panicking, and I said, what is this doing to her? And I was crying, and I kept telling her I was sorry. I just kept telling her, Mommy's so sorry that you're having to go through this right now. It was horrible because I just thought like I was gonna lose her. I really thought I was gonna lose her.
Komen Denver Metropolitan affiliate awards grants to nonprofits who are providing direct services to low-income and uninsured women and men in our community. This year, we awarded $2.9 million into our 19 counties for breast health and breast cancer services.
Having Komen treatment funds makes it so much easier to sit down and work with a person with breast cancer, because you know that you have a resource that's going to say to them, don't worry about the cost of your treatment. We'll get you through that piece of it. We have these funds that are available.
We fund organizations that provide treatment support services because we know that breast cancer affects the family. It affects being able to pay your mortgage and your rent and buy food and groceries. And one of those grantees is Sense of Security.
We are so grateful for the funds that have come from Susan G. Komen. If we just think about how many people will be affected by it, how many people are impacted, I just can't tell you how many tears we wipe away just because we have those funds. They are so vitally important to our program.
It was amazing. It was a wonderful, wonderful day. And she was perfect. Like nothing wrong with her. She came out normal size, even though she was a little bit early. I mean, she was perfect. And she was beautiful. She was the most beautiful baby I've ever seen. Not that I'm biased or anything, but.
We feel so blessed to have Susan G. Komen funding at Clinica Tepeyac. It really feels a huge need that's within our patient population. Most of our women do not get mammograms regularly. Some of them have never had mammograms before, and if it weren't for the Susan G. Komen funding, they would not get mammograms because they just don't have the financial resources in order to get them.
I had a mammogram done in October because I kept feeling just weird little areas, and I just didn't feel well. I was really panicking that something had come back, and so I had a PET scan done. And within a couple days, she called me and told me that I have tumors all over my liver. So not only did I have a reoccurrence that had metastasized to my liver, I had a brand new primary in my breast also that we were dealing with. So it's still very fresh, and it's still something that I have a really hard time talking about. I was going to move on with my life, and I was going to be healthy and not have the worry on my mind. And I never thought in a million years that within 2 years I would have a terminal diagnosis.
I was fortunate enough to have the option to take both breasts or one. My breast never defined me. It didn't make me more or less of a woman. It didn't change the way that my husband looked at me or felt about me.
It's a terrible disease to have to deal with. It brings a lot of fear, devastation to your family, to your emotions, and to see your child go through that was pretty devastating for Mom.
I absolutely feel that going through the journey of breast cancer has definitely created a unique bond between Mom and I.
Absolutely, we have lots of booby talks. We are the booby family.
I am a breast cancer survivor for 35 years, 5 times. Fortunately, the recurrences all took place in the same area, and I'm blessed.
So I've worked with Komen for many years now, but this last year it became a little bit more personal to me because my mom was diagnosed with breast cancer. But fortunately, because of Komen-funded education programs, my mom knew to have an annual mammogram. So she caught her breast cancer very early when it was treatable. My mom knew she'd have a lumpectomy and radiation versus a mastectomy because Komen-funded research shows there's no difference in mortality rate. So I am blessed to work at Komen because my work and the work that the community does is helping my mom live. And that is more than I can ask.
I don't know what's going to happen in my future. I hope that I'm going to be here for a long time. I have a lot of reality that I'm dealing with, but I hope that I've touched someone in some way. If someone heard my story and went and got a mammogram because of it, maybe I saved someone's life. I hope that someday my daughter is proud and that she knows herself and that she doesn't take no for an answer. I think that it's so important to be your own advocate and to know your body. And I will preach that till the day that I die. I just hope to be that person that offers a little bit of peace in someone's life and a little bit of positivity and a little bit of sunshine and in the darkest moments, I really hope that someone can just be strong because of me.
Our hope for the future is a world without breast cancer, a world where daughters don't lose their mothers, mothers don't lose their daughters, husbands don't lose their wives, a world where breast cancer is eradicated, it is ended. It is a world without breast cancer.
Komen is awareness of breast cancer for everybody.
Komen is a community.
Komen is a sisterhood of strength.
Komen is free mammograms for our patients.
Komen is educating, preventing, and eliminating breast cancer in women and men.
Komen is peace of mind for our patients.
Komen is impacting the quality of life of breast cancer patients in Colorado.
Komen is saving lives in our community.
Komen is hope for my daughter.
Komen is hope. Komen is strength. Komen is education. Komen is the path to the future where we will have no more breast cancer.